Hi there, it's Natalie, your wellness consultant, and welcome to another episode of Wellness with Wisdom. Let's talk about improving our focus and concentration in the midst of such stressful times. Some of us may be struggling with focusing in on tasks for prolonged periods of time. Our concentration's off, we're easily distracted, and it's frustrating. Today, we'll focus on improving your focus the natural way. Now, before we dive in, here is my friendly reminder. The information we provide is not intended to be a substitute for medical treatment. Please consult your medical care provider before using a herbal medicine, particularly if you have a known medical condition or if you are pregnant or nursing. If you are worried about any health condition, it is always advisable to have a face-to-face consultation with a qualified healthcare practitioner in order to obtain a diagnosis and treatment advice. Okay, let's get started. We're going to start with a natural substance called phosphatidylserine. So it's a fatty substance. It's also called a phospholipid. It covers and protects the cells in your brain, and it carries messages between them. Now, phosphatidylserine plays an important role in keeping your mind and your memory sharp. We know that through animal studies, it suggests that that substance depletes in the brain as we age. So what exactly does it do? Kind of a little bit more detail. Well, phosphatidylserine is required for that healthy nerve cell membrane. It's called the myelin sheath. It's an insulating layer or a sheath that forms around the nerves, including those in your brain and your spinal cord. And it's made up of protein and fatty substances. So this myelin sheath allows electrical impulses to transmit quickly and efficiently along the nerve cells. So as the human brain ages, then these biochemical alterations and deterioration in that structure starts happening, and then that can impair that transmission between nerves. Now, there are research studies that tell us that we can actually take phosphatidylserine as a supplement, and the dose recommendation is it's pretty broad, anywhere between 300 to 800 milligrams a day. And I'll give you a little bit more detailed description as to how much to use a little bit later on. But it's a pretty broad range in most of the studies. It's very safe to use. The worst thing that can happen is if you take too much, you're going to get gassy or upset stomach. So that would, of course, indicate that you need to reduce the dose. So it is actually very efficiently absorbed, and it can cross the blood-brain barrier. And of course, that means it's going to move right into the area where we need it most. And if we have enough of it, it may actually halt or even reverse some of that deterioration that can happen in your nerve cells. So it's supporting our human cognitive function. And it's very important in helping with the formation of short-term memory. And also, it's very important in helping with the consolidation of your long-term memory, so that you're dealing with the ability to create new memories, but also the ability to retrieve those memories, the ability to learn, and also to recall that information. So impacting your focus and your concentration, your ability to reason and resolve problems, language skills even, and the ability, of course, to communicate. Now, phosphatidylserine, as I mentioned, comes in a bunch of different doses. The recommendation, as I said, is pretty broad. Now, in a supplement, you will normally get it sourced from soy, non-genetically modified soybeans. But you can also get it from a form of lecithin. It's a lecithin ingredient in soy that contains phosphatidylserine. You can also get it from sunflower sources. So if you're not comfortable with the soy source, then there are companies out there that make a version that is sourced from sunflower instead of the soy. Now, the recommendation in the first 12 weeks is to take about 300 milligrams up to double that. So let's say if you're taking a 100 milligram capsule, you can be taking anywhere from 300 milligrams up to 600 milligrams a day for the first 12 weeks. It's a graduated response. So this is not something where you take it and then boom, you see a change. So if you're trying to improve your focus and concentration, you need to be patient with this one. So you can start up with a higher dose or graduate. I would normally suggest you start up with 300 milligrams, so 100 milligrams with each meal. And then if your tummy says yes, then you can up the dose to double that. Stick with it for about 12 weeks. Most of these research studies are about 12 weeks long. All right. And then once you've seen an improvement in that short-term memory, the focus, the concentration, your ability to access your information, you can drop the dose down by half or even down to a third of what you were starting out on. Now, you can also get phosphatidylserine from natural food sources. So, for example, as I mentioned before, yes, it comes from soy, it comes from sunflower. Also, it's available in white beans. Egg yolks contain phosphatidylserine, chicken liver and beef liver as well. But just keep in mind, from the food sources, the quantity is quite small and it is a little bit more difficult to absorb. So companies have manufactured a version of phosphatidylserine that actually is easier to digest than the whole food source, and it can cross over that blood-brain barrier more easily. There isn't even a research study, or a few research studies that were done on children with ADHD, attention deficit hyperactive disorder, using phosphatidylserine and combining it with an omega-3 supplement. So helping those children to improve their ability to focus, but also to help to calm down hyperactive, impulsive behavior. So an improvement in both areas. That was a study in 2012. There's another one that was published in 2014. Same type of idea. They used the supplement for about 2 months, and again, the children saw an improvement in their attention and also a reduction in impulsive behavior, and also what they call auditory memory. So quite effective, and again, of course, safe for children to use. And there are supplement recommendations usually on the side of your label. It will give you an idea as to how much to give a child who's under the age of 12. Okay, so it is safe to give to kids as well. You're just going to have to adjust the dose or speak to your healthcare practitioner about adjusting the dose. Okay, so next remedy for helping to improve our focus and concentration is, as I mentioned, omega-3, so that cofactor to phosphatidylserine. Now, as a standalone, omega-3 can be quite helpful in improving our ability to focus and concentrate. There are research studies that tell us that we can increase that ability by improving the amount of omega-3 in our diet. Now, omega-3 is an umbrella name. It's an essential fat. It's something that our bodies cannot manufacture. We do need to get it through our diet, and it is essential, meaning that we need it for every single cellular function in our bodies, including brain function. Now, omega-3, as I mentioned, is an umbrella name, so there are a few different active ingredients that make up omega-3. And the two major ones we're going to be talking about is EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. Now, these essential fatty acids are the keys to helping with improving cognitive function and even academic performance. What we'd like to see, if you're using an omega-3 supplement to help with, specifically to help with your focus and concentration, you want to find a formula that's much higher in the EPA ingredient. It doesn't have to be just solely EPA. In fact, I like to see formulas that include both ingredients. But the goal is to get a higher concentration of EPA, because that's really the ingredient that's going to make those changes in that focus and concentration. And as I mentioned in the earlier segment, improving attention deficit hyperactive disorder as well. So the EPA ingredient should be at least equal to 500 milligrams per day. And in some cases, I will recommend up to 1500 to 2000 milligrams per day, depending on the client. So you want to graduate that dose. So take a look at the side of the label when you purchase your omega-3 supplement, and look for a formula that's tipping up higher on that EPA ingredient, a little bit lower on the DHA, and work your way from 500 milligrams upwards, depending on how you respond to it. So what exactly do these do? Well, these essential fatty acids are generally considered to help to modulate neuroplasticity. So neuroplasticity is also called brain plasticity or brain malleability. So it's the capacity of neurons and neural networks in the brain to change their connections and behavior in response to new information, sensory stimulation, development, and even damage or dysfunction. So it's also very important to have high levels of these omega-3s when there is, for example, a concussion or a brain injury. But in the case of focus or concentration, it may help the brain to respond better to very stressful situations. Stress changes our brain chemistry, and especially prolonged stress, like the kind of stress that we're going through right now, changes our brain chemistry. So increasing that amount of EPA can help with taking that plastic malleable brain that we have and focusing on adjusting it and improving its ability and a better response to information, so we can gather information better, that we can retain that information and access it, and that we're appropriately responding to sensory stimulation, so we're not overreacting and having a very stressful response, because that of course is going to have a negative impact on your ability to focus or concentrate. Now, there are essentially two categories of omega-3s. You can get an animal source, you can get a plant source of omega-3s as well, and there are some quite effective, quite potent plant sources of omega-3s out there on the market right now that have been converted. Regular omega-3s from plant sources don't actually contain this EPA and DHA ingredient, and they actually have to be converted by the body through your digestive system into these EPAs and DHAs. There are newer technologies on the market where these plant sources have been converted for you, so look at those labels again carefully. Unless you have a really strict vegan or vegetarian diet, it is much more cost effective to find an omega-3 that is sourced from fish, because it's less expensive, but you can also get much higher doses without having to take huge quantities, because the only unfortunate part with the plant-based ones is that your volume, you have to take a lot of it in order to get those therapeutic doses. So consider the fish sources. There are good companies out there that are certified by the International Fish Oil Standards, that's IFOS. And that means that they are also responsibly harvesting the fish, and they're using normally small fish, mackerel, sardine, or anchovy or herring. And these products are being tested for heavy metals, PCBs, and environmental contaminants. So they are pure, they're clean, and they also randomly batch tested as well for those same categories that I just mentioned. So again, be mindful of that. And if you need any advice on brands that are very responsible with manufacturing and careful about their quality control, you can always reach out and I'll be happy to point you in a direction. Okay, I'm back this time with a herbal that you are probably quite familiar with, and it's well recognized for maintaining healthy brain function, and it's Ginkgo biloba. So it's also known as the maidenhair tree. Ginkgo is one of the oldest species of trees in the world. The trees can grow more than 130 feet tall, and they can live for over 1,000 years. Some trees in China are said to be over 2,500 years old. The tree is considered to be a living fossil, meaning that it has continued to survive even after major extinction events. So a fascinating tree, a fascinating plant, and it has a lot to offer to us. The Ginkgo biloba extract is from the leaf of the plant, and it's found to improve behavioral performance on working memory. So what is working memory? So working memory is one of the brain's executive functions. It's the ability to hold on to new information so we can turn around and use it in some way. So working memory allows us to hold on to information without losing track of what we're doing. So multitasking essentially, and being able to access information while essentially doing other tasks. All right. So the dose recommendation. Well, the dose recommendation is pretty broad. In research studies, it can be anywhere from 120 milligrams up to as much as 600 milligrams. So again, I would normally suggest starting out on the low end and graduating the dose depending on how you respond. Now, it helps to moderately enhance a number of cognitive processes in healthy young individuals, as well as those people who are suffering from age-related cognitive impairment. So pretty broad range in the age benefit as well. So it's not just for those senior citizens with aging brains, but also has been beneficial for those young ones as well. Active compounds, when you look at your label, you want to see that it's standardized to flavanol glycosides, about 24%. They're also called terpene compounds mixed up in there, ginkgolides, and there's a bunch of other tongue-twisting names like proanthocyanidins as well. But you want to see that 24% and 6% standardized extracts on the side of the label, because that means the company is following the research-based potencies. And those particular compounds have been shown to be potent free radical scavengers, so they're protecting the brain. They have antioxidant properties, and they also do help with improving brain function by increasing blood flow. They promote dilation of blood vessels, and this has the benefit of increasing the amount of oxygen that's being circulated to the brain. So mental capacity, mental fatigue, helping to make us feel more mentally alert, and thereby improving our focus and concentration, and even not just improving that mental performance, but giving us a perceived sense of well-being. So if we can oxygenate that brain, our brain is a happier brain, we're going to feel better. And of course, we're going to see those improvements in our mood as well. We're going to have a better sense of being more secure, and that sense of well-being. So Ginkgo comes in capsules. And in the capsule form, you're going to follow the dose recommendations, the milligram dose recommendations that I mentioned earlier, the 120 to 600 milligrams. It also does come in a tincture form, so that's the liquid form in drops. And then you essentially want to follow label recommendations, because tinctures, liquids, have a higher absorption rate, so you don't need to take as many milligrams in a day. Tinctures are already in liquid, your stomach doesn't have to solubilize it. If you want to increase the absorption, put the tincture directly under your tongue, hold it for 10 seconds, salivate, and then swallow. And what that will do is it will help some of that active ingredient cross the mucous membranes under your tongue. So you're going to get some ingredient going directly into the bloodstream right off the bat. So with tinctures, you don't have to take as many milligrams. Usually they're taken 2 to 3 times a day. So just follow the label recommendations. And if you need to increase the dose, then speak to your practitioner as to how you should safely go about increasing the dose. All right, next on our list of natural remedies to help to improve focus or concentration and impact that in a positive way is vitamin B12, or specifically methylcobalamin. Now, the research studies tell us that participants with low to normal vitamin B12 levels demonstrate lower learning abilities, and while those with normal to high levels of B12 demonstrated higher learning abilities. We know that B12 is needed to form memories, and also it's needed for focus and concentration. So how do you know if you need to take vitamin B12? What are your risk factors? Well, the obvious one is you go for your physical. Normally your standard physical will give you a full blood test, and they always check your B12 levels. It's naturally part of the blood test. You don't even have to ask. So if your family doctor calls you and says, hey, your B12 levels are low, you need to take a supplement, that's obvious. Take your supplement of B12. Now, some of the other risk factors where you have a higher risk for B12 deficiency would include if you are a vegan or vegetarian, because there are very few natural vegetarian or vegan sources of vitamin B12, and when it is present, it's in quite a low quantity. So B12 is actually found in its richest sources in animal sources over plant sources. If you're over the age of 60, and that's going to impact your absorption or conversion of vitamin B12. So taking a readily absorbable form of B12 like methylcobalamin would be very important, because your digestive system doesn't have to do any work. It's ready to go. If you're taking acid suppressing drugs, you need a certain level of acidity in your digestive system in order to metabolize vitamin B12. And if you're taking a proton pump inhibitor or anything for acid reflux, then that is naturally going to cause you to develop a B12 deficiency. So you will have to supplement. Also, the medication metformin for diabetes. So not insulin, but metformin, which is a form of prescription drug that's taken in a tableted form for diabetes. It's going to increase your risk for B12 deficiency. If you have a chronic digestive disorder such as Crohn's, celiac disease, or irritable bowel syndrome, and it's impacted because B12 is converted by our friendly bacteria, our probiotics in our gut, and if we have these chronic digestive disorders, generally speaking, our probiotic levels are going to be low, and then that conversion of B12 is going to be poor. And our probiotics also manufacture that from food. They manufacture that active form of B12. If you have an eating disorder, of course, that's another risk. If you've had weight loss surgery, like bariatric surgery, if they increase the or reduce the size of your stomach or anything like that, that's going to reduce your body's ability to convert vitamin B12, so it's going to have a negative impact. If you have H. pylori, that's the bacteria that causes ulcers that impacts your B12 levels. If you have an alcohol addiction, if you abuse alcohol or nitrous oxide, that also inhibits vitamin B12. And if you are HIV positive, then you're also going to need to take a vitamin B12 supplement. Now, vitamin B12 has a cofactor, so a friend that it needs to be taken along with, and that is folate or folic acid, vitamin B9. So these two vitamins are inextricably linked together due to their complementary roles in something called the folate and methionine cycle. So a deficiency in B12 results in a functional deficiency in your folic acid or your folate. Right, because the folate becomes trapped in the form of something called methyl tetrahydrofolate, and it doesn't get converted properly. So, short form, in layman's terms, make sure that you're taking your B12 and your folic acid together, all right, because they need to be together. You can buy vitamin B12 in a sublingual form, so those are little tablets that you just let them dissolve under your tongue. You can get it also in drops, and again, it will be sublingually. So either tablets or drops. My advice is to just go with a sublingual. Buying a vitamin B12 tablet that you swallow is going to be counterproductive, especially if you have the chronic digestive disorders, eating disorders, H. pylori, or any of those things, because those are going to inhibit your body's ability to absorb the B12 if you swallow it. So try and do something that is sublingual, under the tongue. Okay, last but not least on my list of natural remedies to help to improve our focus and concentration is L-theanine. So L-theanine is an amino acid, and it can be naturally sourced from green tea, and it has a modulating effect on caffeine, on attention. So it can help to increase your focus and attention. And modulating effect means that it helps to balance out some of the possible side effects of caffeine. Some of us are taking in caffeine because we are mentally tired, we can't focus or concentrate because there's mental fatigue. The downside of taking caffeine as a remedy, of course, is that there's a crash over time. So in other words, you feel great and then boom, you feel really low. It can be addictive. Caffeine can lose its effect over time, so you have to take higher and higher quantities of it, which then becomes more stressful for your body. You're adding more stress, so this is of course going to have that reverse effect on causing less ability to focus and concentrate. So kind of a wicked backlash and a vicious cycle. So adding in L-theanine helps to modulate that. It promotes relaxation and focus during stressful times and helps to calm down some of the nervousness or restlessness that you may get from caffeine. Now, it is the kind of relaxation without drowsiness. So how does this work? Well, in our brain, we produce a bunch of different types of brain waves, and one type of brain wave is called an alpha brain wave, and it's measured in hertz. It's between 7 to 13 hertz. And that, when we see that alpha brain wave, it's indicating a state of awake relaxation or calm focus. So this is the mode in which ideas come readily and creativity skyrockets, but you're still feeling chill, you're feeling relaxed. Think meditation or flow state. So several trials performed on both high anxiety and low anxiety test participants concluded that L-theanine supplementation increased alpha brainwaves within 30 minutes 30 minutes of administration, which help foster a relaxed state in both groups. So it works on both areas, both ends of the spectrum, whether you have high anxiety or low. So bottom line, you don't need to be anxious to take L-theanine. If you want to take L-theanine because you're trying to improve your focus and concentration, absolutely do take it. It will not make you feel drowsy. It will help with increasing your attention span. All right, so you can focus for longer periods of time, and it reduces reaction time in people who are already experiencing anxiety. So of course it has that positive benefit. The dose recommendation is about 250 milligrams. You can do that once a day. One other thing to keep in mind is that it's a supportive mechanism. So L-theanine is behind activities in the brain that enhance GABA levels, and GABA levels help to increase like your dopamine and your serotonin. So as part of our better focus and concentration, dopamine, serotonin, they make us feel good. So we're not just feeling calm, but we're feeling that sense of well-being again. So 250 milligrams. Now there are a couple of options really with L-theanine. As I mentioned earlier, 30 minutes, it's a pretty quick response time. So there are L-theanine supplements that you can take periodically. In other words, if you want to just take it occasionally, there's a chewable form of L-theanine, and they're usually about 125 milligrams per chewable, so you can take as many as you need, up to 250 milligrams. But with a chewable, the response time is going to be a wee bit faster, maybe 15 to 20 minutes. So you can use chewables as needed. All right. Or if you find that you're really struggling with your focus and concentration over the long term, you can get a 250 milligram capsule and just take it once a day. There are even companies that do a slow release, so it's a 250 milligram that's gradually released over about 6 to 8 hours, so you can kind of get that longer benefit over a full working day if you wish. Okay, so you have some options there. And just keep in mind, there are companies that make a synthesized version of L-theanine, so try and find the ones that are sourced from green tea, because you're going to get some additional cofactors that you wouldn't normally see if you have a synthesized version of L-theanine. And I'm back. So that was my short list on natural remedies that can help to improve your focus and concentration without side effects, things that are not habit forming that you can safely use. Okay, that's all I have for you today. If you have any questions, please feel free to reach out and I will be happy to respond in further detail. Keep in mind that you can also find me on my YouTube channel, Wellness with Wisdom, or on Instagram at wellnesswith_wisdom. Thank you so much for taking the time out of your day to have a listen to this broadcast. Practice patience. Practice positive intention.
Thank you so much for watching.
Generosity.
I hope you found this video helpful. If you did, please consider clicking the like button, subscribe, and yes, hit that notification bell so you'll know when next I post new videos. Have a wonderful day and keep well.